And Dr. Andrew Chang is here with us right now from the California Proton's Cancer Therapy Center. Welcome back.
Thank you, Ken. It's always great to be here.
Yeah, good to see you back again.
To see you as well.
And, you know, we just saw that spot there,
right,
dealing with breast cancer, and that is what our topic is today. I know in the past you have touched on it, but we're going to go into more detail. So what are some of the advances in medicine that have come along for treating breast cancer?
Well, fortunately, one of the things that we're starting to see now is we're finding breast cancer at an earlier and earlier stage. And I think that's because the last few decades, we've done a really good job of encouraging women to get screened with the annual and regular mammograms.
Now, when you talk about the screening, when is the right age? I mean, is there, I remember, you know, it used to be after 40, maybe once every few years, and after 50, you know, more and more. Is that sort of the consensus still, or has that changed?
Yes, that still is indeed the consensus for recommendations, but it does vary a little bit depending upon a woman's family history.
Right.
So a woman who has a lot of sisters or aunts and grandmothers and mothers, if there's a history of cancer that runs in the family, we do encourage the woman to get screened potentially even earlier than that.
Okay, and they have the mammograms, and they also have a little bit more advanced screening as well.
That's correct, yes. One of the things that was difficult to do for younger women with mammograms before is the younger a woman is, the more difficult it is to find breast cancer on a mammogram.
Oh, okay.
So one of the things that people are starting to look at is potentially the use of MRIs for breast cancer detection. And we're starting to see that can be very helpful in some women's cases as well.
Okay, and that might be something you use if you know there's a history.
Exactly,
okay,
exactly.
So let's talk about the proton therapy. How does that benefit breast cancer? And when is that the right treatment?
So that's a great question. In the treatment of breast cancer, typically it involves multiple different specialties together. And oftentimes there's surgery involved, as well as potentially for chemotherapies or hormonal therapies that come along with it. Proton radiation is a form of radiation that allows us to pinpoint a little bit better where we're giving that radiation. And so for women who have had surgery and will be requiring radiotherapy, protons could potentially give less radiation to the other breast, the rest of the normal breast tissue, and potentially, especially if the breast cancer is on the left side, avoiding or eliminating radiation to the heart and the lungs that sit underneath it.
Okay, and that's because the proton therapy is pinpointing, am I right?
That's correct, that's correct. It's like that example I give of a standard radiation being like a shotgun hitting everything in the area. Proton radiation is like a target rifle, allows us to pinpoint where we're giving that radiation. One of the things we've seen with women is as we get better and better at curing breast cancer, women are living longer and longer, and we start seeing the long-term side effects of that breast cancer treatment. Especially for women with breast cancer on the left, one of the things we see from radiation is they can have a higher chance of developing heart disease because that heart sits just right behind that left breast.
Right.
And with proton therapy and being able to pinpoint it, we're often able to minimize or completely eliminate that radiation to the heart. And so the idea is, as we cure the cancer, preventing the woman from getting that heart disease or other disease in the future.
As far as the therapy goes, would it be done in conjunction with chemotherapy as well, or that just depends?
That also depends on the aggressiveness of the tumor.
Okay.
Likewise, whether or not a big surgery or a smaller surgery, what we call a mastectomy or a lumpectomy is done, is a little bit of personal choice from the women, as well as a little bit of how is the tumor situated in the breast and the size of the tumor in the breast. And depending upon all those factors, we would, as a team, decide surgery is good, chemotherapy is good, hormone therapy is good, radiation is good, and sometimes one or two or all three of the combinations.
Okay. Now, with the proton therapy, is it a quicker process? Is it something that is ongoing for weeks compared to standard radiation?
Yeah. So in general, the radiation treatment is the same.
Okay.
And so most women, when they're coming for radiotherapy, whether standard radiation or proton, it's a daily treatment, Monday through Friday.
Okay.
Typically anywhere from about 4 to 6 weeks of that treatment. Now, there are some interesting trials that are starting to come out of right now, looking at, since protons can be very focused, can we compress that several weeks of radiation down into just a few weeks? I'm currently running a trial actually in the United States that open at multiple centers throughout the United States looking at that.
Would that be, let's just say hypothetically, because I don't know. Let's say over the course of 8 weeks,
Sure.
somebody does that 4 days a week or twice a week or whatever. They're still getting the same amount of therapy. It just, you can do one in the morning, one in the afternoon. Is that sort of what's being looked at?
Exactly. That's one way of doing it, doing
Okay.
2 treatments a day, so some in the morning, some in the afternoon, to shrink that several weeks down. Another way of doing it is saying, can we just give more radiation on each day's treatment so that you can do the whole treatment in, say, 10 treatments instead of 30 treatments? And that can compress the amount of time a woman needs to come for radiotherapy.
Very good. That would be very good news.
Yes, yes, and we're starting to see very good early results from that as a result.
What about working with their primary care physician? You know, from there, of course, and they're going to be, if there is breast cancer, if they detect it or they think there might be a possibility, you know, they're referred to somebody, a specialist in there. Would that be directly to you folks, or once they get to an oncologist, then from there, they would work with them and say, we want to look into the proton therapy?
Sure. It can actually come from either way.
Okay.
We do have women coming from their primary care physicians, but the majority of them are patients who've already gone to see a cancer specialist. Typically a surgeon, so a breast cancer surgeon who has taken out the cancer and diagnosed it, will then say, you're somebody who potentially could benefit from radiotherapy. Proton therapy may be an option for you.
Okay, what about if they don't need surgery? I guess what I'm asking is, if they're finding a very small amount of cancer in there, can they go directly using proton therapy, or it has to be used in conjunction with surgery?
So at this current stage, people are evaluating that, whether one can do radiotherapy instead of surgery, but for the most part, most women would benefit mostly from a surgery first prior to any radiotherapy. And so generally we would say, no, we should get the surgery and not proton itself. Unlike something like prostate cancer, where one could do proton radiation
Right,
instead.
that's what I'm, yeah.
Exactly.
Yeah.
Breast cancer is one we tend to say surgery is the cornerstone treatment for breast cancer.
All right, very good. Great to have you on here today.
You're welcome.
And if you are interested in finding out more, you can go to californiaprotons.com, and that will give you more information. Their number, by the way, they're down in the San Diego area. That's their direct number, 858-549-7400. And you can find out more information there. But you know, next month we're going to have, so did you say Dr. Rossi on?
Yep, Dr. Carl Rossi, our medical director and world expert on prostate cancer.
All right, very good. Always good to see you, doctor.
Pleasure.
You take care.
Thank you.
And we'll
Yourself.
be right back.
Bye-bye.